A number of sources influence the level of calcium in the human body: bone resorption, diet, vitamin D, which increases intestinal absorption of calcium, and oral calcium. Patients with chronic kidney disease, or CKD, who are also on dialysis, may be exposed to even more calcium in the face of calcium dysregulation. Increased calcium burden, elevated serum phosphorus, and calcium are highly correlated with vascular calcification and cardiovascular mortality. A number of studies have shown a positive association between oral calcium dose and the progression of vascular calcification. And for these patients, calcification is exceedingly more prevalent, more severe, and follows an accelerated course. There are two types of arterial calcification: intimal and medial. In medial calcification, calcium deposits form in the middle layer of vessel walls. This is generally observed in muscle-type conduit arteries, such as femoral, tibial, and uterine arteries. Medial calcification is common in patients with CKD on dialysis and may result in increased vascular stiffness, elevated pulse pressure, left ventricular hypertrophy and dysfunction, and even contribute to heart failure. Studies have shown the presence and severity of coronary artery calcification to be important predictors of all-cause mortality in CKD patients on dialysis. In a study by Block and colleagues, 1/3 of patients had a calcification score of 0 at baseline, which was associated with a significantly lower mortality rate. Another third had scores from 1 to 400, which were associated with increased mortality. The final third of patients had severe baseline calcification scores, greater than 400. In these patients, the mortality rate was significantly more pronounced compared to patients with a baseline CAC score of 1 to 400. A separate study by Blanchet and colleagues found the number of calcified vascular sites to be predictive of all-cause mortality risk. From 17% all-cause mortality with one site to as much as 73% increase in risk of death with 4 sites of vascular calcification. What is the prevalence of calcification in your CKD patients on dialysis? Studies have shown calcification in 64% of new dialysis patients, 73% in new dialysis patients with diabetes, and 83% in prevalent dialysis patients. Furthermore, the latest KDIGO guidelines suggest that patients with CKD stages 3 through 5D with known vascular calcification be considered at highest cardiovascular risk. While there are some factors you can't control, there are others you can. What steps will you take with your patients?